Welcome to Variations 4, the cardiovascular unit. We're covering questions 19 and 20 in this video. Various forms of carditis. Peri, endo, and myocarditis. So first, let's look at these layers of the heart. What are they? Picture from your textbook here. So the most inner layer of the heart is, as the name would indicate, the endocardium. So when we look at the endocardium, we're really looking at all this area in here, and that includes valves. And that's really key to note, because when we have things like, damaged valves or some infectious process, some fungi on the valves or something, or any inflammation around the valves. We're looking at endocarditis with obvious repercussions. If these valves are inflamed, then they're not going to close properly. They're going to allow regurgitation of blood going back, and you're going to have two problems with that. What are they? Pooling and decreased cardiac output, not to mention the fact that you'll be ejecting infectious material into the body, and you got a chance for sepsis as well. So that's a really quick and dirty of endocarditis. We'll get into a few more details in a minute. If we move to, though, this is just a quick overview here. The next layer is your myocardium, and that's the heart muscle itself. And if that's inflamed, well, that's not going to work properly either. So you're going to have contractility issues and kind of filling and emptying issues, not to mention probably some discomfort in your chest. Finally, you've got the pericardial region, and the pericardial region has fluid in it to cushion the heart. It's a very delicate organ here, of course. And so it's filled with fluid. That fluid can become infected. And if that becomes inflamed, pericarditis, but you got a real problem there, because you've got this sac, the outermost layer of the heart, not a lot of wiggle room here. So if that becomes inflamed, then what's going to happen? Not only will it be painful, but it's going to press against the myocardium, and that's not going to give it much room to fill. It's going to be painful as it tries to do its work. So a few issues there around pericarditis. So now that we've kind of gone through a visual, we'll just kind of go through the shopping list of, what are we going to do about this, and anything else that we may have missed in the last little discussion here. So we'll start with the innermost layer, the endocarditis. All of this being right from your Lewis textbook. As I'd said, valves and endothelium of the heart are obviously inflamed, likely due to an infection here. Antibiotics will, of course, be started. It may actually require surgery for a valve replacement, though. In terms of diagnostics, well, here's your list here. I'm really not feeling like reading through each item here. I think if you read through the list, based on what we just talked about, it should make pretty good sense. ESR and C-reactive protein are non-specific inflammatory markers. It tells you you've got inflammation somewhere. It doesn't tell you where, but they're useful if you're trying to narrow things down. Someone says, I got chest pain. Okay, so what is this here? If you're thinking a possibility of infection, it's not the worst idea to get this little bit of blood work done. Echocardiogram, obviously it's allowing him to go right in there, take pictures of the valves and look at things, which helps to see if there's vegetative growth on the valves and if they're closing properly. Hopefully the rest of those items makes pretty good sense. In terms of signs and symptoms, I'm certainly not going to read through it, but if you think about the infectious process and you think about a compromised heart, I would say that pretty much all of these items make perfect sense as you read from head to toe what manifestations there may be. Okay, so the next one we'll go to going to the most outer layer now, the pericarditis. That's the fluid sac that surrounds the heart. There's a number of potential causes up here that could cause that to become inflamed. Your symptoms here, again, this is the one with very sharp chest pain because you're basically kind of putting a stranglehold on the myocardium in general. Lying supine increases the pain potentially because lying down can increase your preload with a quicker flow of blood back to the heart, filling more efficiency and pressing. So I mean, it can be said that if you have pericarditis, laying down flat may not be your most comfortable position in terms of pain and workload on the heart. So our diagnostics, again, we might be looking at an echocardiogram, um, lab work, same as above, really. Cardiac enzymes. I mean, these parts, there's not a whole lot of difference between the different conditions. That being said, don't worry about the friction rub. We're not going to go through that. That being said, you know, not sure why it's not here, but they may need to draw some fluid out of the heart here. Oh, sorry, here it is. So just, okay, I'll get to that in a second. Some symptoms. You might have some pulmonary tissue compression as that part of the heart's pressing, inflamed and pressing against the pulmonary area. This goes hand in hand with what we said above. Now, down to a list of treatment modalities here for this. Making sense, ABX, of course, decrease your inflammatory process. These meds make sense. Same thing with your NSAIDs. And this is what I was getting at up above, the drawing out of fluid from the pericardial space might provide A, help in diagnosing what's going on in that fluid, and B, a little bit of relief from the pressure against the heart muscle. Okay, the last topic here is myocarditis itself, a whole garden variety list of causes up here in the rectangles. Idiopathic means not known. It could just happen. Hopefully that's not the case, but it can just happen. It can be all over the place. It could be in one place. It's inflammation of the heart muscle, as we said. Depending on how bad it is, you might have a really inefficient heart and end up with your whole CHF deal. Maybe it's not so bad at all. Benign means not much happens at all. It could be so bad that you just have sudden death, basically. It might be something that accompanies pericarditis. And so in that way, it's similar to the signs and symptoms. You're looking at basic cardiac management, keep the person alive, basically. So therefore, the treatment's not really anything specific. It depends on what's causing it. You have to really look at which one of these little items up here is causing it. That's going to dictate what we need to do in terms of, anti-inflammatories, immune depressants, antibiotics, and just what's the cause? Is it a virus, et cetera, et cetera.